Good morning, everybody. And again, thank you very much for attending the session today. So just a little bit about me. My name is Mandy Emery, and I work at the East of England NHS Collaborative Procurement Hub. We're based in Cambridge. My role day-to-day is as Sustainability and Social Value Specialist, and I support our teams internally to ensure that the frameworks that we deliver have the right sustainability and social value additions to it. And we also support our members in the East of England, which is the hospital trusts that we work with, and we support them with their social value and sustainability needs as well. A little bit about the East of England NHS Collaborative Procurement Hub, which is where I work. So we are hosted by West Suffolk Foundation Trust here in Bury St Edmunds. So we are one of 4 collaborative procurement hubs across the country, each of us covering different regions. So like I say, we cover the East of England. We have 2 sort of what do I say? 2 roles that we cover. One of them is as framework hosts, which means that we deliver frameworks like the one that we're talking about today. And we also support our in-region trust, like I mentioned, here in the East of England. We are a not-for-profit, so all of our income is reinvested into the NHS. Any surplus income is reinvested into the NHS. And we use that, obviously, that support to improve procurement across the region. So while our member base is in the East of England, we do operate nationally, so that includes Scotland, Wales and Northern Ireland as well. This means that we can work more in collaboration with other regions and with other procurement hubs, so that just does help deliver that additional benefit to the NHS through procurement. Straight onto the framework. So I just wanted to give you a brief overview of what exactly a framework is. Sometimes the word framework can be used in a number of contexts, and I just wanted to be super clear about what we're talking about today. So in this context, a framework is an agreement that's established between a public sector organisation like us or like a NHS trust and several suppliers. So it's made up of a list of pre-assessed suppliers who have been evaluated and selected to deliver a defined set of services. The framework provides what we call a compliant route to market. So if you're aware of how public procurement works, it can be quite complex, and a framework offers a route to access suppliers who have already been pre-assessed to deliver services. And that just means that a contracting authority like a trust or local authority doesn't need to hold a procurement competition every time that they need something. So the contract that you hold for the framework will be between us and yourselves if you do go on to apply and you're successfully awarded. And then any subsequent contracts, call of contracts will be between yourself and the contracting authority. So it sounds like a lot now, but it does make more sense during the session. So the framework has been established under the Procurement Act, which has been in place now for just over a year, and it replaced the earlier public contract regulations after we left the EU. And like I said there, it's open to all public sector organisations across the United Kingdom. So local authorities, universities, schools, anyone can use this framework, and then obviously that does include NHS. So the social impact framework is the framework that we're discussing today, and this is the first of its kind nationally. So it's been designed to support community-led services that improve outcomes. So really the focus on this framework is prevention and tackling the wider determinants of health that obviously dictate our own individual well-being. So it recognises that health is shaped by more than clinical care alone. And like you see there, what the framework is for, it's for supporting local and community-based organisations to work with the NHS. It enables services that respond to local need and lived experience. It creates space for preventative and early intervention approaches, and it values outcomes linked to the wider determinants of health. So you'll see when we come to the lot overview that it covers quite a substantive amount of services, but you will see that they actually do tie into that wider preventative care package. So what does this look like in practice? Services delivered through the framework are place-based and relational, not transactional. So those relationships with the areas that you work in are really what drives this framework. Impact may be delivered through small targeted interventions, and then value is measured through outcomes and change is sustained. So it's not just about numbers on a sheet, it is actually about those lives that have been improved because of the services that you've delivered. So a little bit about how it might look in practice, and I do appreciate that it's quite small on the screen, but I think it's a bit clearer in the presentation pack itself. So it's just a visual of how it might work. So we've got a team from Riverdale Hospital, a pretend hospital, with the local authority and an ambulance service, and they've discussed that there's a big need for improved mental health services. Admissions for mental health related incidents have never been higher, and the hospital is starting to struggle, and finding the right solution feels like an impossible task. One of the colleagues says, have you heard about the social impact framework? So Alex, the procurement specialist over there, looks up the social impact framework and realizes it will help solve the issue. So because the framework holds the names of pre-assessed suppliers ready to deliver those mental health services, it becomes much easier to award a contract. So later, a contract is signed between the supplier and the contracting authority, and then within 12 months, mental health related admissions are down by 40%, social calls served by ambulances have reduced by 15%. This hypothetical CRC has employed 23 staff from disadvantaged backgrounds and those with lived experience to deliver the contract. Procurement and commissioning has saved 345 procurement hours, and then Riverdale Hospital frees up crucial resources to focus on other key priorities. So it does say that this is all hypothetical, but it is not unrealistic. Some of those figures are potentially quite close to where they might sit. So it's just to give you an idea of what it might look like once you're on the framework and how it might be used. So the current position at the moment, we are in the first live iteration of the framework. So that went live on the 8th of December. So the successful suppliers that were awarded last year, that they're now able to deliver that work. So we had 202 suppliers awarded across 23 lots, and most of those suppliers were successful on more than one of those lots. We had 23 suppliers excluded, and that was due to incomplete submissions. And then you'll see on the right-hand side there the breakdown of how many organizations from the voluntary sector, SMEs, or other organizations. So this is the first reopening of the framework. I'll explain a little bit more how we've been able to reopen it, but this is the first time we're reopening it for new suppliers, and equally for existing suppliers to apply for new lots. Interest has been building, so we've had quite a positive response to the framework. We've got one contract awaiting signature, and there's several in the pipeline that we're just waiting on other pieces. So because we're in the first reopening, we had quite a lot to learn during the process last year, and we just wanted to be really upfront about some of the lessons that we learned and some of the pieces that came out of the first tender. It's important to note that there's only so much that we can influence as the framework owner. A lot of the ask that we have to put into the framework is through legislation or legislation-led, and also through NHSE policy and guidance that we need to implement certain things. So we have tried to reduce a lot of the burden to allow those small organisations to participate in the tender, but there is still the regulations, the Procurement Act, everything that gets passed down from the government onto the NHS and onwards, we do still have to take that into consideration. And it's important to remember that there is still public money that is being spent, so we need to make sure that we have the right checks in place to make sure that that's spent wisely. So some of the pieces that we learned Some suppliers told us that public procurement felt complex and hard to navigate, particularly for smaller community-led organizations. There was confusion about what a procurement framework actually is. Some organizations thought the framework was a funding opportunity or a live contract, rather than a route to market that commissioners may choose to use. So VCSEs and SMEs highlighted structural barriers to engagement. So that was including limited capacity, time pressures, and some disproportionate requirements. Expectations around areas such as social value, carbon reporting, and compliance were sometimes perceived as unclear or misaligned with organizational scale. So we obviously can't favor or preference any individual supplier, which means that the ask is the same across the whole supply base. So small organizations or organizations that have not worked with public sector procurement before found that it might have been quite misaligned with the size of the organization. And then the volume of information and unfamiliar procurement language made it harder for some suppliers to understand what was being asked and how to respond confidently. So in the scope of what we could change, these are some of the lessons that we learned and what we've done about it since. So we've improved the pre-tender engagement to help suppliers understand the framework and the procurement process before the tender opens. So this is one of those sessions, and hopefully at the end of the session you will feel a little bit more confident about what we're asking and what you'll need to do going forward. We've developed a short explainer series to break down key procurement concepts, including what a framework is, how bids are evaluated, and how to approach each envelope. The link to that will be at the end of the slide pack. That's just on a YouTube channel. So it's just quick 2-minute videos on some of the key areas of procurement, and it just helps, sometimes visual learners prefer watching a video over reading a lengthy document, for example. The bidder handbook issued with the RTT has been updated and provides clearer, plainer English guidance on how to complete the tender, similar to the information pack that was issued with this pre-market engagement. Hopefully it does cover a lot of the information that you would need to be able to apply for your submit your bid. So we've added clearer explanations of the procurement regulations that apply and why certain steps are mandatory and where flexibility is possible. We felt like this was a really key element that we had missed out in the first iteration, in that procurement regulations are complex, but it doesn't help if you don't understand what we're actually being asked to do through legislation, because sometimes it can feel like it's just being asked for the sake of it, and it feels quite bureaucratic when actually it is something that's legislated. So just help to have a bit more information on that. And then the tender this year has been scheduled outside of summer holiday period to give organisations more time and capacity to engage. Over last year we had it over the summer holidays, and we heard that was really a difficult time for a lot of small organisations, or just in general organisations that weren't able to submit. So some of the key highlights for this framework. This framework is really about creating a simpler way for the NHS and public sector to work with community-based providers, like many of you here today. So it's designed to be flexible and responsive. So when a trust or an ICB or a local authority needs a particular service, they can come straight to the framework and find the right provider quickly without needing to run that full procurement process each time. During the development of the framework, we held co-design and supplier engagement sessions to really understand how we could make it work for everyone. And like we've acknowledged, it's not been a perfect journey, but we're still learning. This is an open framework, so this means that it's not a one-time opportunity, and this is what I meant earlier when I said we were reopening it. So because this is an open framework, we are able to reopen it at set intervals. So we're reopening it now in 2026, and then we do plan to open it again next year again. So if you're looking at the opportunity and thinking it looks great, but you're not quite ready, don't worry, you will have another opportunity to join the framework. So we've structured the framework into 23 themed lots, covering things like mental health support, food and financial security, carer support, supported living, and others, again, around that prevention and addressing those wider determinants of health. So this also makes it easier for you to apply for areas that are most relevant to your service specialisms, or you can choose to submit tenders for a number of lots where you're able to deliver services. So just to bring that all together, so just to be super clear as well about what a framework is and what it isn't. So framework is a pre-vetted list of suppliers that public sector organizations can use to buy services in a compliant way. So we say can use because it's not the only way that they can purchase services. Oftentimes a framework makes it a much simpler route to market. It makes it a bit easier to find suppliers, but it's not always going to fit every scenario. They're not always going to have the services that are needed. It might be too nuanced and need to go to open tender anyway, but it is a way that commissioners can buy goods and services. So it's a structure that sets agreed terms, service descriptions and quality standards in advance. So once you've submitted your responses and your documents at the tender stage for the framework, that will be visible then to commissioners who wish to use the framework, and then you won't need to keep submitting that each time an opportunity arises. And obviously you'll be able to then see the terms and conditions that you'll be held against beforehand, so you know there's no surprises once you're awarded. And then again, it's an opportunity for suppliers to be visible and eligible for future contract opportunities during the life of the framework. So what it isn't, it's not a funding pot or a grant scheme. It's not guaranteed contract or income. There's no fixed or guaranteed contract values attached to being appointed to the framework. So if you've seen the tender notice from last year or any of the other notices on find a tender, you'll see that there's proxy values attached to each lot. Those are just the anticipated spend that we think might go through the framework, but it's not guaranteed, and that would be split across a number of providers anyway. And then as the framework matures, we'll be able to understand exactly what the level of spend might be. So it's not mandatory for contracting authorities to use the framework. Like I said, it is sometimes easier, but it's not mandatory by any means. And it doesn't prevent organizations from working outside the framework through other commissioning routes. And that applies whether you are or you aren't on the framework. So if you are in the framework and you want to pursue other contracts, you're absolutely welcome to do that. And if you aren't on the framework, it doesn't stop you from working with the NHS if they're running open tenders anyway. So this is the lot structure. So when we speak about lots, we basically mean how the procurement is broken down into smaller chunks, and that focuses on service specialisms. So it allows for you, like I said, to submit your bid for service areas that you are most qualified for, and it just helps you, and all suppliers apply for the services that they can actually deliver under. So we've got three themes. The first one is voice and influence. So those lots cover the representation services, and then system leadership and infrastructure representation services. Then theme two is the community-led services for social impact. So that is obviously the core of this framework. And I won't go through each one, but you'll be able to see that, as we referenced earlier, it is a lot about that prevention, helping communities solve problems in the community rather than needing to move to acute services to help them. And then theme three is the prevention and cessation services, and so that's aligned with the NHS prevention plan. So tobacco, weight management, alcohol harm, and respiratory health. So it is obviously quite a lot of services, and as the framework matures, we may remove some of these lots or add new lots. It depends on how the framework is used, but we wanted to cover a lot of the key areas in one framework, so it kind of did become a one-stop shop for prevention, essentially. So a little bit about the public procurement regulations. So in the public sector, procurement is highly regulated, and this means that we have sets of rules to follow, and that's to ensure that public money is spent wisely. We have to make sure that the process is fair, open, and provides value for money. So there are some elements of the tender that we can control, like the support we offer, the questions we ask to ensure that you're able to deliver the services under the framework. But a lot of the process that's followed is actually mandated through government controls and regulations. So right now there are 3 different procurement regulations governing public procurement. So the first one is Procurement Contract Regulations 2015, which is now obsolete. It's been replaced, but there are still contracts out there that are under the PCR regulations. So it means that it's not gone away completely. So the Procurement Act 2023, that's the regulation that we all follow now. And that's been in place now for just over a year. So February 2025, it actually went live. And then the provider selection regime, which covers healthcare in England only. So that's quite different. And like I said, this framework itself is under the Procurement Act. So in addition to those 3 governing acts and regimes, we also have to adhere to the Public Services or Social Value Act and separate procurement policy notes, as well as separate NHS England policies and approvals. So there's new legislation coming out in May called the NHS Procurement Slavery and Human Trafficking Regulations. So we will now need to have enhanced checks on our frameworks to make sure that the risk of modern slavery is addressed and mitigated. And then, as many of you will be aware of the NHS net zero targets, we're hoping to be net zero by 2045, but we can only do that if we manage that supply chain and their carbon emissions as well. So a lot of what we ask in our procurements are because we're being mandated to do it. So do understand that it looks like a lot of work, but it's not just for fun. There is an important reason behind it. And like I say, we are at the end of the day dealing with public money, and we want that to go, we want that to be spent wisely and securely. So I hope that helps just have an overview of the procurement regulations. So next we'll move on to the procurement process, and it's just a summary of it, but there's a lot of support we can support you. There's a lot of support online as well, and hopefully this session as well will give you some of that guidance. So the process itself, when it opens, and the current opening date is the 11th of May. So read the tender documents and ensure that you can deliver the service. You'll need to register an account on what's called the Central Digital Platform, and then you'll need to register a separate account on the Atamis Supplier portal. So I'll speak about these 2 individually in a second. You'll need to complete what's called the procurement specific questionnaire, and then complete the core questions. So there's core questions and then there's lot specific questions. I think there's 5 core questions and 2 lot specific questions, one of it being a case study. Then once you've done the core questions and the lot specific questions, you'll need to complete your social value response, and then the commercial schedule. And then after that, there's a separate document called the tender declaration form that you'll need to complete. Once you've done all of that, you'll upload your commercial schedule, you'll upload the completed tender declaration document, and then by the deadline, you'll submit your tender. There's just a little note there at the bottom. It's just one thing we realized last year is that if a change is made to the tender while it's live, and you've already submitted your bid, the status of your bid will move back to incomplete to allow you to make any changes. So that is done automatically, and it doesn't, I don't believe it actually alerts you that it's done that. So we recommend that you set a reminder to double check your bid is definitely submitted before the deadline. We did, I think, have maybe 1 or 2 suppliers that had submitted, but then because the status was pushed back, it didn't register, and we were able to resolve that. We didn't have to exclude them or anything. We were able to sort that out. But just do set a reminder so that it actually does submit. So I'll just break down some of the core platforms and the sections of the procurement just in a bit more detail. So the Central Digital Platform is a single online system for public procurement under the Procurement Act. So it is part of Find a Tender as well. So you will be able to look for opportunities on the same portal or the same platform, but you'll need to register your information on there. And what happens is your core information is then stored in the Central Digital Platform, and you'll be given a unique identifier that you can then share across all different procurements. So it just helps reduce that duplication, and you only need to sort of update your core information on one system, and then it should reflect across the procurements that you apply for. So you must register on the Central Digital Platform and obtain a share code, because you will need this for your application. And you'll see there's a link there to the CDP, the Central Digital Platform as well. So Atamis is the Department of Health and Social Care's commercial system. So it's used by a large number of NHS trusts, arm's length bodies, and public organisations to manage their procurements and the contract activity. So this is where we will publish the tender documents and where you will ultimately submit your bid. This is also where you can ask any clarification questions. So there's no other alternative to submitting your bid. So we don't obviously accept paper bids or anything by email. All of the tenders have to come through this system. So you will need to register for an account to access the documents and to be able to actually submit your tender. So the specification, as you mentioned earlier, is outcome focused. So rather than prescribing how services must be delivered, we've set out the intended social, health, or well-being outcome that the service is designed to achieve. So as long as your services can meet those outcomes within that specification, then you should apply for that lot. But do always read the complete specification before you go ahead and submit your tender, because your responses will need to align with the specification, what's being asked. The procurement specific questionnaire, so this tends to be the first part of the procurement that you'll actually complete. And it's to confirm your organisation is eligible and set up to deliver services under the framework. So most of it focuses on compliance and capability, so that would include things like any exclusions, if you've previously been excluded from a procurement, or if your organisation has been subject to an investigation for modern slavery or anything like that, you'll need to declare that at that stage. And then obviously also insurance, financial standing, and health and safety capability will also be demonstrated in this section. So it is pass fail, so many of the questions will just be kind of yes or no, or you'll need to upload certain documents, or just briefly explain what you do to cover a certain topic, like your health and safety, what health and safety you have within your organisation. This is a mandatory section, so you will need to complete the whole section. But a lot of it you will already have, and then a lot of the information that is needed in this section will automatically pull through from the Central Digital Platform, which is why that code that you'll need to get is so important. Because if we don't have that information, we will need to come and get it from you. So the technical envelope is the bulkiest envelope, because this sets out how you will deliver the contract. So this is where you will explain how you'll deliver the contract under those services, and it'll assess the quality rather than the price, and focuses on your approach, experience, and ability to meet the specification. So this is about service delivery, quality assurance, risk management. How will you actually meet the ask of the specification? Responses to the technical envelope are scored against clear published guidance, so you'll be able to see what we're looking for in your responses. Strong answers are clear, relevant, and directly linked to the contract requirements, rather than generic descriptions of your organisation. So this is why it really is important to read that specification, because you will need to evidence that you can meet the services that we've set out in the specification as part of your response. Evaluators will tend to look at the specification, look at the evaluation guidance, and then score your tender based on that. So please do read that spec when you're answering this question. And then this is also mandatory, so you will need to submit something for this envelope, otherwise your bid would be incomplete. The commercial envelope is where you will set out your pricing. So in this framework, we haven't asked for set pricing. We've actually just asked for your percentage uplift, and that was to enable a level playing field when evaluating. So it's an Excel spreadsheet that you'll need to access, complete, and then re-upload once you're ready to submit your tender. So this is a mandatory section as well. You will need to complete the section as well. And obviously if you do have any questions about it, please do use the mechanisms available to you through the clarification questions process. Then the social value envelope. So this asks you to lay out your additional social, economic, or environmental benefits you will deliver through the contract. So this is also a mandatory section, and it's mandatory for all procurements under the Procurement Act. There has to be a minimum of 10% weighting. The social impact framework actually has a 20% weighting. So you'll need to set out how you will meet the outcome that's been selected. We do have a social value webinar coming up at the end of the month. There's still time to register. There's a link at the end of the slide deck to access the registration form. So if you do want to hop onto a webinar just to understand a bit more about social value, you are more than welcome. And we'll just sort of cover each of the outcomes in a bit more detail. And then clarification questions, which we spoke about. So this gives suppliers the opportunity to ask questions about the tender during the live procurement process. So because we have to obviously treat everyone fairly, all questions come through the same route. They are then added to a document, responded to, and then shared with all suppliers. So unless there's something commercially sensitive which is removed, all suppliers will be able to see all of the questions and answers. This just means that no supplier receives additional or private information. And just to say, the clarification questions are asked through Atamis. So standstill and award. Following the evaluation, suppliers are notified of the outcome and provided with feedback through an assessment summary. So every supplier, whether you've been successful or not, will receive what's called an assessment summary. And this will outline your scores that you were given and some of the comments and any suggestion on how to improve your tender for future procurements. So the assessment summary then triggers what's known as a standstill period, which is an 8 working day period where nothing progresses with the framework. And this just allows suppliers to raise any formal challenges before the contract is formally awarded. So this stage supports transparency and gives bidders insights into how their submission was assessed. So one of the areas we wanted to be completely upfront with is the activity-based income and the 1% contribution. So the contribution is applied to income that you generate on the framework. So just a summary here. So what is ABR? It's a 1% contribution applied to all business awarded under the framework. So the ABR value is an inclusive element of your tendered prices and supports us as a not-for-profit organisation to keep our business functioning essentially. And it just helps us, you know, with the framework hosting, supports those business activities. What is it used for? Like I said, to maintain day-to-day business operations. It's used to develop, manage, and assure compliant NHS frameworks. It helps us provide ongoing support to NHS organisations and suppliers. And then surplus income is reinvested back into the framework. How it's paid, it's self-reported monthly via the My Alliance portal. Reports must be submitted by the 10th of each month, including nil returns. Reports must clearly reference the framework lot number, and the invoices are issued quarterly by the hub. So we will, if you are awarded a contract through the framework, you will have a separate onboarding session with our data team, and they will go through the whole process with you, show you all the forms and the logins and all the rest of it. It is a very straightforward process, and because of the size of the framework, you won't actually be expected to report anything until you've received your first order. From then on, if you receive additional work through the framework, you'll be expected to report on it, and if not, you just click a single button that says null return, and then that just updates our system, and just helps us sort of manage our supply base as well. So do you need to pay ABI? Yes, ABI is payable at a rate of 1% on the net invoice value. So this applies equally to all suppliers to ensure fairness and consistency, and is common practice across all frameworks. Spot checks are carried out periodically to confirm reporting accuracy and compliance. So we wanted to be a bit upfront about it, but just to reassure you that joining the framework is completely free. There's nothing that you need to pay. It's only 1% on the invoice value, should you be awarded a contract through the framework. So a little bit about top tips for strong bids. And you can read this at your own leisure, but it really is important to answer the question that's been asked. So really make sure that you read that question and respond to it in a way that we can evaluate. We can only score against the published criteria, and we can only score of what we see. So if you've got an absolutely fantastic project, or or you've delivered a fantastic service and it's on your website, we can't go off and look at it. We have to evaluate based on what you've written in your response. Be specific and use examples. So general statements score lower than clear examples that show what you've done, how, and with what outcome. So it really, really shout about the work that you've done, but obviously make sure that it's relevant to the specification and the lot that you're applying for. Align your responses across envelopes, so your technical, commercial, and social value responses should be consistent with each other and with the specification. And obviously what's being asked at tender stage. So check the attachments and the declarations. So you need to make sure that all required documents are uploaded. Double check them before you submit. Make sure you haven't submitted anything that's blank. For certain parts that perhaps if you've submitted the wrong document, we can actually come back to you and just ask you to submit the correct document. So don't feel like if you make a mistake, that's it, you're out. We will work with you as much as we can to make sure that you're able to submit your bid. But please do just help us by making sure that the documents and any submissions you need to upload are actually done when you submit the bid. Plan your time and don't leave submission to the last minute. So we've had a little bit of feedback that it is a lengthy process once you start getting into it, especially if you're applying for a number of lots. One of the organizations that we spoke to who applied for, I think, 4 lots, said it took about 3 weeks to get everything together and then to actually submit the bid. So do allow the time to submit a bid. Don't leave it to the last minute, or you will probably run out of time. Especially if you're a first-time bidder, it can sometimes take a bit longer than you expect. If you're unsure, ask. So if something is unclear, raise a clarification question through the system during the live tender period. It's better to ask early than to make assumptions that could affect your submission. And there's no such thing as a silly question. If it's already been answered, we'll link you to the previous question where we've answered it, or we will do our best to answer any questions that you have about the process or the framework. So using AI in your tender. So we recognize that AI tools can be helpful, particularly for organizations with limited capacity. So we don't discourage the use of AI to support bid writing. We do just ask you to check that the information that you're getting from your AI chat is accurate. We did come across a number of very generic top level answers that just we couldn't score very highly because it just didn't answer the question. So if you are using AI, always review and check your responses. And then try and use it as a support tool, not a replacement, because really, the services that you're delivering, the real lived experience, I don't think that you can truly relay that through a purely AI generated response. So do use it as that support tool, but don't rely on it to get that emotive element across. Be cautious of generic or incorrect content. So AI, as we know, can produce confident-sounding answers that may not always be accurate or relevant to the contract. This is sometimes called hallucination, but you do need to just check that it's not happening in your responses. So don't simply copy and paste what comes out. Really do read and agree with what's coming out and what you're putting into your bid. And they keep responses contract specific. So make sure that your responses actually show how you will deliver services under the framework. We're looking for how you will deliver the outcomes in the specification, but overly generic responses can score poorly even if they look like they were well written. So timeline and next steps. What happens after award? So once you're awarded a place on the framework, you'll have a supplier onboarding session with myself, where you'll be able to explore more about how the framework operates in practice, a bit about the promotion and marketing of the reward, how commissioners access and use the framework, and then a bit more about the ABI and reporting requirements. So it's usually like an hour session with all of the awarded suppliers, and we do obviously welcome questions, and we'll try and support you with the process as much as we can. And then after that, obviously, we are here. We don't just award you and then disappear. So we do like to have that open communication with you. So once you're awarded, do keep in contact with us. If you're not sure on something, we're happy to support you along the way. We've also created a social impact framework supplier network on Futures. I don't know if any of you have heard of it, but it's an NHS focused networking page online, but we do have a group on there which we can add you to. That just helps you connect with other framework suppliers, explore partnership and joint working opportunities, and then access shared learning and updates. So one of the things that came out of the first iteration or the first iteration of the framework is that a lot of suppliers do actually want to work together, especially across bigger projects. So this was just a way to sort of bring everyone together and be able to facilitate that. So what happens after today? So the tender goes live on the 11th of May and it will close on the 6th of July. So July to November, we'll evaluate those tenders and issue assessment summaries, and then December the framework contract is awarded. And remember, that is the framework contract between us and yourselves, saying that you are set up to deliver services under the framework. It's quite a long evaluation period because the first contracts went live in December last year. We can't move that date, but because we've obviously moved the opening date a bit earlier, just it seems like a long assessment period. But the contracts will go live in December. So we really want suppliers and attendees of this call to feel empowered to make the right decision for their organization. This framework is designed to be inclusive, but it does need a level of readiness to operate in a public sector environment. So really, if you want to consider whether the framework's right for you, it would be right for you if you deliver services that clearly fall within one or more of the framework lots. You're comfortable working under public sector contract terms, you have capacity to complete a tender submission, you can evidence your experience and outcomes, and you're looking for a way to work more closely with the NHS and wider public sector. It might not be right for you if you're seeking grant funding rather than contractual work, or if you're not yet ready to operate within formal procurement processes, or if you're unable to commit time to preparing a compliance submission. So just remember that if it sounds interesting but you're not ready yet, we'll be reopening again next year. So you will have an opportunity then to submit a tender. So accessing the pre-market engagement, there is actually a video as well that you can watch. It takes you through the process step by step, but this is the step by step on how to access the pre-market engagement. So it is on Atamis. So if you do go onto Atamis and register an account already, then you've already ticked off one of the actions before you submit your bid. I won't read through every step because you'll need to follow it as you're going through the process. But included in the pre-market engagement opportunity on Atamis is all the documents that you might need, including a bit more information about the lots themselves. There's also a handbook, a supply handbook that talks to you a bit more about the framework, what's expected, a bit more guidance on how to submit some pre-market engagement questions. It is quite useful. So if you read that, and then if you have any questions after that and the other documents that are on there, then do submit them through the portal. Once pre-market engagement closes next week, we'll be able to collate all the responses, and then we will either have another session before the tender reopens, or issue some other guidance or additional videos or anything like that, just to provide that support. So some of the important links, it would have been stuff that we've spoken about in the session. There's a how to register your organization. It says find a tender, but it's the central digital platform. That's just a step-by-step on how to actually do that. There's a little bit of guidance on the Procurement Act to sort of explain what it's about and what it means for you as suppliers. Atamis has some supplier help as well, and if you are struggling to access Atamis, their support team is actually really helpful. So if you just drop them an email, they will get back to you with some support. The PPN 002 that refers to the social value model, but do attend the social value session on the 29th of April if you can make it, but it will be recorded and saved on our YouTube channel if you would like to catch up. And then there's just the other links to the tender